This podcast discusses real-life experiences that may include topics such as grief, trauma, medical or mental health challenges, and other emotionally sensitive content. Please take care of yourself while listening, and if at any point in the conversation you feel overwhelmed, it's okay to pause, step away, or skip this episode entirely. While some of our guests are licensed professionals, the Holiday Survival Podcast is for informational and educational purposes only and should not be considered medical, psychological, or therapeutic advice. If you are struggling or need support, please reach out to a qualified healthcare provider or mental health professional. Now, let's begin. The holidays can be the most wonderful time of the year, or they can literally be the worst. That's why I'm bringing back the Holiday Survival Podcast, the show that gets real about a season that isn't always merry and bright. If the holidays bring up stress, grief, pressure, complicated family dynamics, or just big emotions, you are in the right place. My name is Erin Billings, and I am your host. In each episode, we'll have honest conversations, share practical tools, and offer hope for anyone navigating the messy, beautiful, and emotional reality of this time of the year. No forced cheer, no sugarcoating, just real stories, real support, and reminders that you are not alone. I hope that you enjoyed the show. Welcome back to the Holiday Survival Podcast. This time of year brings crowded schedules, colder weather, and cold and flu season, all of which can take a toll on our health. Today's guest is Dr. Shikha Jain, a board-certified hematologist and oncologist, Associate Professor of Medicine at the University of Illinois at Chicago, and Director of Communication Strategies at the University of Illinois Cancer Center. She's also the founder of Women in Medicine, a nonprofit advancing equity and leadership in healthcare. In this episode, we'll cover practical strategies to stay healthy during the holiday season, from supporting your immune system and managing stress to separating fact from fiction when it comes to health guidance in the media. Dr. Shikha, thank you so much for being here. We've been friends for a little while. I'm excited to have you on the podcast so that you can share your wisdom with our listeners.
Thanks so much for having me. This is one of my favorite things to talk about, so I'm really excited for the conversation.
Well, why don't you introduce yourself, who you are, what you do, so that our listeners can get to know you better?
You mentioned a little bit in my bio, but I am a triple board certified hematologist, oncologist, and also board certified in internal medicine. I am an associate professor, which basically means I also teach at the university and across the country on anything related to oncology, hematology, and medicine. I'm also a national media contributor, so you might have seen me on TV or one of my op-eds talking about a lot of different public health topics and just fighting misinformation to the best of my ability. And then the nonprofit that I founded, it's been around since 2019 was our first summit. 2021, we became a 501c3, Women in Medicine. People call it my fourth child because I have 3 little kids, and Women in Medicine is my fourth child, and really proud of the work we're doing there. And I just love educating and empowering people, especially in the holiday season, but throughout the year, to help them take control of their own lives, because there's a lot of misinformation out there. So helping them find accurate information to help make themselves stay as healthy as possible throughout the year is a joy. I love imparting that type of information to people.
I love hearing it from people that actually have credentials to be able to talk about it.
Agreed.
It's one of those things where I've seen some of the work that you've done with Governor Pritzker, and I think that is such important work that you're doing because there is so much medical misinformation out there. But we'll get more to that later. The holidays are a prime time for colds, flu, and even stress-related illnesses. From a medical perspective, why is this season particularly challenging for our immune systems?
Especially in areas like Chicago, where I live, it gets colder. People are inside more. People are just gathering more. Plus, it's the holidays, so you're getting together for Thanksgiving, for Christmas, for New Year's. And so we're gathering inside. It's also peak cold and flu season. So not only are we inside more, we're also surrounded by people who have runny noses, who are sneezing, who are coughing. And so those things combined can make us more prone to getting infections, getting sick. On top of that, the holidays come come with its own stress. Stress itself can make you more at risk for developing illnesses. Sleep deprivation, I don't know about you, but the holidays I sleep, it feels like 50% less than I do the rest of the year, plus stress and worry and anxiety about presents and gatherings and family dynamics and all of those things. So all of those things together, it creates a perfect storm of why we see more and more people sick and even admitted to the hospital during the winter months.
Yeah, that totally makes sense. What are some evidence-based ways to keep your immune system strong during these colder months?
So the first thing I want to say is there's a lot of stuff out there that claims it's going to boost your immune system, like a lot. I will tell you, even as a physician and as a mom, I have bought some of them before. And some of it is really just a placebo effect in my brain, where if I feel like I'm getting sick, I'm like, I'm going to take some emergency because I think it's going to make me feel better. And honestly, it makes me drink more water, which I think is what actually helps. Keeping yourself hydrated is really important during the winter cooler months. You can get dehydrated, which can definitely make you more prone to illness. That sleep thing I talked about, I try to practice what I preach. I'm very bad at it, but trying to get 8 hours of sleep a night, if you can, at least, is super important, and restful sleep. So going to bed, making sure you don't have devices, making sure you've got good sleep hygiene. So not scrolling on your phone until right before you fall asleep, getting into that REM sleep. So sleep is really important. Getting your vaccines. So we talk about boosting your immune system. Vaccines, the flu shot, the COVID vaccine, the RSV vaccine, the pneumonia vaccine, the shingles vaccine. These are literal ways to boost your immune system. And the thing a lot of people don't realize is they're natural ways to boost your immune system. So a lot of people don't think of vaccines as natural, but they really are. They're not medications. There's something that you inject into your body that will tell your immune system to activate against these potential assaults on your body. So when you think about boosting your immune systems, vaccines is the best natural way to actually protect yourself from getting sick. And then healthy eating. So we always talk about healthy eating, cutting down on processed foods throughout the year. There's a lot of sugar and sweets that happen around the holiday time. When you're not eating healthy, you also have a propensity for getting more sick. Limiting your alcohol intake at these celebrations and things you're going to. I don't know about all of you or your listeners, but I get invited to a lot of holiday parties during the week, office parties, evening events, daytime events, and it feels like alcohol becomes a centerpiece of a lot of them. So making sure that you're being very cognizant of how much you're drinking and not overindulging throughout the holiday season and throughout the winter months. Also, we saw this a lot during COVID. We saw a lot more binge drinking during COVID because people were inside more, and that's carried over to what we see in the colder months. So alcohol is something that just important for you to think about how much are you actually taking in during this time.
I love that you brought that up because I've had other guests on the podcast before that talked about just being more mindful of your alcohol intake, not just for the health effects, but also for the mental, emotional effects as well. So I love that you brought that up. Stress tends to spike during the holidays. You've mentioned that, from travel to family dynamics or work pressures. How does stress affect your immunity, and what are some practical ways to manage it in the moment?
So stress can absolutely impact your overall immune health, especially in the moment, because what can happen is you get this kind of boost in cortisol. And oftentimes when you're stressed, some people get face flushing, or they get their heart racing, or they get headaches. So all of those things in combination can be due to hormone surges in your body. So there's a couple of ways to handle it. One, which is very hard during the holidays, try not to put yourself in situations where you're going to be around stressful people. Now, obviously, when you've got family and friend gatherings, especially in the holidays, that's not always possible. A couple of things that I recommend to patients is, number one, breathing. If you're in a situation and you just need to take a minute and step out away from the situation, go to the bathroom, take 10 or 15 deep breaths just to bring your heart rate down, to calm yourself down. Those are some really good strategies in the moment to try to bring your entire immune system back into some kind of balance. Sometimes what some people do is they start meditation during this time of year. New Year's resolutions, people start exercising again, but meditation, incorporating meditation and regular mindful in your daily routine, could be first thing when you wake up, could be in the evening. That can help center you for the rest of the day. The next thing I'm going to say sounds really silly, but I tell my kids to do it, and it actually works. when you're in a bad mood, let's say you had a bad day at work or you're stressed because you've got like 20 things to do and you don't have time, putting a fake smile on your face actually sends signals to your brain that confuse it because you're angry, but you're smiling. So what's happening? And so if you put that smile on your face, it can actually change your entire demeanor without even doing anything intentionally. Don't do one of those like clenched teeth, I'm angry smiles, but like an actual smile on your face can actually change the entire way your brain is thinking. And then a lot of people go to therapy. I think therapy can be really helpful. If you haven't gone to therapy before and you feel like you need to go to therapy, the holidays might be a good time to start.
True.
If you feel like you need somebody to talk to. And also making sure you've got a support system in place, because sometimes it might not be a therapist, it might be a friend or family member. Know who you can talk to if you're struggling, because we also see an increase in really sad things that happen around the holidays. We see an increase in suicides and things like that. So if you're feeling stressed, if you need to talk to somebody, please reach out to someone, either a trained professional or to a family or friend who can help you navigate.
Love that. The part about smiling made me laugh because when I was touring full time, I used to get in trouble because of my face, because my face can't lie. And I was on stage at festivals in front of thousands of people. I actually got moved behind the curtain because I was glaring at my drummer because he missed a cue. And I was giving him the death glare. So from that point on, I was told by the artist, smile when you get mad. So I would smile, but it would be that teeth clenching, it'll mess you up after this. So I'm sitting there laughing because I'm like, oh, I automatically do that now because that's how I communicate my irritation with my musicians.
Absolutely. And it works if it's a good way to communicate without yelling at anybody.
It does, and it saves face, literally, whenever you're on stage.
Absolutely.
I've gotten myself in trouble many times with my face.
I have too. I have a very emotive space. And so when I'll be on Zoom meetings and I'll get a text from someone, you should probably check your face. So it's definitely happened to me as well. And one thing I forgot to mention, which around the holidays is super, super important. We travel a lot. We fly, we drive, we interact with people who we might not otherwise be interacting with. We're in airports. So one thing I tell people, I still wear a mask when I fly, especially during cold and flu season. And I'm not making a political statement. I'm not telling other people they need to do it. I'm not telling people around me they need to do it. But the reason I do it is because when you're in a confined space with a lot of people during cold and flu season for an extended amount of time, the chance of you catching something, catching a virus, catching a cold, catching something from all the people around you is very, very likely. I've gotten sick from flying on planes before as well. So that's one thing that I recommend. Keep some masks with you. And if you don't feel comfortable wearing it, but if you're in a place where somebody all of a sudden is coughing a lot or sneezing a lot, maybe just throw the mask on and keep hand sanitizer with you if you can, because again, hand washing is key throughout the year, but especially during cold and flu season, you want to be making sure you're washing your hands or having hand sanitizer if you can't get to a sink.
Yeah, I love that. I keep my Young Living hand sanitizer that smells so good and doesn't dry out your hands. I keep that in my purse at all times.
Yep.
And even sometimes with traveling, because I still do a lot of music work and travel during the holidays specifically. And so I'll carry those wipes that I can wipe off the tables and stuff like. I'm a little bit of a clean freak. It's an issue. But no, I think those are great tips. Something I wanted to ask you, what is going on with COVID? Is that just a part of the cold and flu season now? Are we having spikes? Are there new variants? Is there anything you can share with us about that?
So the challenge is, because of what's happened over the last year, the information we're getting is much less and it's not as accurate. So that's challenging to really understand how much COVID we're seeing, where all we're seeing it. I will say that we are still seeing COVID in the hospitals. I am still seeing people who are sick with COVID who are admitted to the hospitals because of COVID, but it is significantly better than it was at the beginning of the pandemic. So we're not seeing hospitals full of COVID. What we are seeing, though, is COVID patients throughout the year. So I anticipate as this continues to evolve, we will continue to see more COVID patients during cold and flu season because of the things I mentioned, but we will also see COVID patients throughout the year. There are new variants that have been identified, but again, because of what's happening, we are not getting as much up-to-date and accurate information as we were prior. So I don't feel as informed as I was, say, 2-3 years ago. Also, because during the pandemic, we were getting flooded with so much information all the time, the natural evolution was we were going to start seeing less and less information. But the concern now is a lot of the things that were being done before to monitor and assess and keep track. Many of those things are not happening anymore, so it's hard to get a really good idea. But I will tell you, in the physician forums I'm in and talking to other physicians across the country, we are definitely still seeing COVID. There are new variants coming. There is a new COVID booster, so I would recommend that everybody get their COVID shot if they have not. And I anticipate it's going to turn into a once-a-year shot, just like the flu vaccine is, unless we start seeing new variants come up more often than once a year that are very virulent, then we might need to get boosters throughout the year. But for right now, what I'm doing with my family is we're doing at least annual COVID shots. And if information comes that there's a new variant and there's a new shot that targets it, we will be getting that as well.
Okay, that's really good information. I know with you being an oncologist, something that I think would be important for our listeners to hear is what should they do whenever they have family members and loved ones that they're around at the holidays that are immunocompromised? How can they create a safer environment for them?
It's always hard if you have a cancer diagnosis or if you have any sort of immunocompromised medical condition during the holidays, especially because you want to spend time with family, but you don't always know how you can do it safely. So the first thing I recommend to everyone is to encourage your family members who you're going to be interacting with and engaging with, encourage them to get their vaccines and get them up to date at least 1 to 2 weeks before you're going to see them. I've actually had patients who they said, my family has never gotten vaccinated. They don't believe in it. And I tell them, I was like, I totally understand. Talk to them about the fact that now you are actually at very high risk and you could end up in the hospital and potentially even die from one of these viruses. So see if you can just talk to them about it and see if you can convince them. And more times than not, I've had patients come back and say they've been able to convince their family members who've never gotten vaccinated to get the vaccine because they are immunocompromised and they want to protect them. So I think having those conversations with your family is really important. I don't think there's any issue with you wearing a mask around people, especially if you're at a family gathering, especially if there's children around. I have 3 kids. They are germ magnets. Somebody always has a runny nose or a sneezing or coughing. And if you're a grandparent, you want to spend time with those grandkids. You don't want to say, oh, I can't spend time with you because you've got a runny nose. So wear a mask, keep the hand sanitizer on. But if any of the family members or kids do have a fever or are actually sick, try to stay away from them as much as you can. You don't want to end up getting some sort of illness, especially over the holidays. And talk to your oncologist, talk to your doctor about other things that might be helpful for you. If you're getting chemotherapy, I sometimes change my patients' chemotherapy schedule so that they are less immunocompromised around the times where they might have a family gathering that's really important to them. So I've had patients who've said, I'm supposed to go to a holiday party with my grandkids on this date. I know usually day 10 of my chemo is when I'm most immunocompromised. Can we change the dates a little bit? And we can try to modify that for you. If it doesn't impact your overall treatment plan, that's another thing you can potentially do as well.
I love that. I've never even thought about asking to change your treatment schedule to accommodate the gathering. That's great.
That's why I tell people all the time, your oncologist and your doctors think about you even when you're not in the room. And we're constantly thinking, how can we help this person have the best quality of life while we're still trying to save their life? And so it's that balance. And so having that open dialogue with your healthcare team is so important because we will do everything we can to try to help you live the best life you can in whatever way we can.
And that's why we love our medical professionals. So I want to talk about some of the misinformation that we are getting in the media these days. A lot of people that I know personally have stopped looking at the media. They've turned off the news stations just because there's so much misinformation, but it's also polarized information. But specifically around health guidance, how can listeners sift through the noise and know what advice to trust?
So I want to emphasize something first. Science is fact-based, period. I always paraphrase a quote from Neil deGrasse Tyson where he said something to the effect of, your opinions don't measure up to my facts. Like, your opinions are opinions, they don't measure up to my facts, which is true. Just because you say, I am the Queen of England, does not make you the Queen of England. So I think that's really important. And science in the United States has been built on peer review, on objectivity, on publishing data, and on synthesizing all of the information to provide public health messaging to the public that has evidence and science behind it. Unfortunately, what's happening right now is there's a lot of people who are coming after scientists who have dedicated their lives and really sacrificed so much to do this work and are accusing them of making a profit off of this. So I will tell you, first of all, your physicians, your scientists, the people doing this research, we are not doing it for a quick buck. There are a lot better ways to make a quick buck than to spend 4 years in med school, 3 to 7 years in residency, 3 to 7 years in fellowship, going into immense amounts of debt, and then having to pay back that debt for the majority of your young adult life. Oh, and missing out on most of your 20s and 30s because you are constantly in the library studying and training. There are way easier ways to make a quick buck. So the first thing I say is look where your data and science and evidence is coming from. There are a lot of influencers out there who are claiming their energy drink or their boost or their treatment is better than what the doctors are recommending. Figure out if that person is getting a cut of the money, if it's their own product, if they're benefiting in some way. Because if they are, it's more than likely that is not a good product. So that's number one. Number two, look at other things these people have said, because if they are saying a bunch of things that are all conspiracy theories, if they're saying things that have been proven by science for years and they're trying to now disprove them with their own research, just because you call something research, it's not research. I'm going to say it again. Just because you call something research does not make it research. Research takes sometimes decades to go through, and some of the things that we are doing now is based on decades and decades of research. You cannot just undo all of that with the snap of your fingers. So think about where the information is coming from. Think about the people who are giving that information. Anybody who is offering you a quick fix, I can tell you most quick fixes are going to be a scam. And doctors went into this field to try to help you. We want to help you. We took a Hippocratic oath to do no harm. That is what we want to do. And many of us are parents as well. So imagine, do you think I would give my kids, for example, vaccines that I thought were going to harm them in any way? No. Do you think that I would do things to my own body intentionally that were going to be dangerous? No. So think about that. And then the last thing I'll say is misinformation is not new. It's been around forever. I can go through a whole list of misinformation that's been around forever, and you would say, wow, I didn't know that. It's not new, but with the internet and with the rise of the social media influencer, and now with what's happening in our country, we are seeing it out of control. I mean, it's snowballing out of control. Before you could control it because people listen to the experts. Now everybody with a TikTok handle can call themselves an expert. And so we're really fighting an uphill battle here. There are even physicians out there who are saying things that are completely not fact-based. So you're smart. Your listeners are smart. You're educated. It's even hard for me sometimes to figure out, is this real? Is this not real? So the couple of things that I tell everybody to do. One, look at the source. Where is the information coming from? Are they benefiting from this in any way, whether it's monetarily, whether it's from their own platform, their own brand? How are they benefiting from it? Number two, take the information to your doctor, because maybe the social media influencer is saying something great, but it might not be right for you because what they're recommending might interact with the medications you're already on. They are not your doctor, but your doctor is. So take the information to your doctor. And the third thing, and this is the most important, question everything. I tell my patients to question me. Ask me, where is this data coming from? What is a clinical trial? Why are you doing this? How is this decided? Question everything. And honestly, at the end of the day, it's your informed decision on what you're gonna do. But these people who are out there fear-mongering and saying things that are just, I don't even want to call it misinformation. They're lies. They are just lies. To say vaccines aren't safe is a lie. It's not misinformation. It is a lie. To say that there are microchips in the vaccines is a lie. To say that you should send your kids to a measles party instead of getting the measles vaccine is not only a lie, it would likely harm your child and potentially kill your child. To say that ivermectin cures COVID and cancer is a lie. We need to use the words. We need to be very clear when we talk about these things. These are not facts. They are not alternative facts. They are flat out lies. And we need to get back to where we trust our experts, realize that our experts are doing this because they want to help you and not because they're trying to put a quick buck in your pocket like a lot of these influencers are.
Clock that. That was a whole word. So, looking ahead, are there any tips or practices that you'd recommend starting now that can help people stay healthier and feel more energized throughout the holiday season that can carry into 2026?
Absolutely. So first, don't wait until January 1 to start your exercise routine. If you are not currently exercising, try even 3 days a week to just get moving for 15 to 20 minutes. I will tell you, I was the worst culprit. I have 3 kids. I stopped exercising for a significant amount of time. My husband is actually the one who was like, you used to be athletic, you used to be fit, and then you just stopped. And I said, oh, I don't have time. He was like, make the time because it's your life. And now I've been going to the gym 2 to 3 times a week for the last 2 months, and it's completely changed my mental health, my physical health. So start exercising if you have not. And like I said, don't go try to train for a marathon if you've been sitting on the couch, but start 15 to 20 minutes a day, 3 to 5 days a week. The second thing, if you haven't gotten your vaccines yet, now is the time. Find out which vaccines you're eligible for. The COVID vaccine, everyone should know, everybody is eligible for the COVID vaccine. You should all be getting it. If the pharmacy gives you any trouble, everybody has some sort of pre-existing condition. A high BMI may put you at a pre-existing condition. All right, do you have diabetes? Do you have heart disease? Do you not exercise? These are all things that could put you at the ability to get a COVID vaccine. So get your COVID vaccine, get your flu shot, and all of the other shots that you are eligible for. Highly recommend doing that now. The third thing, start working on your sleep schedule now. So try to get those 8 hours of sleep at least a night you can now. Think about habits that you've formed over the last year. And again, don't wait till January 1. Start working on them now. Look at your holiday plan. Look at what you're doing over the next couple of months and figure out, okay, I'm going to 6 holiday parties that week. Let me think about how I'm going to manage my caloric intake and also my alcohol intake during that time. I'm going to limit myself to 1 drink at each party, which still is over the recommended amount for a week. But if you're going to parties, let's say 1 week you've got 6 parties, 1 week you've got none, fine. This week you can have 1 drink at each party. Next week, don't drink alcohol at all. So figure out what that balance is and think ahead for your calendar. Add in 5 minutes a day of meditation if you can, just to recenter yourself and connect with family. Family and friends are really what the holidays are all about. If you're estranged from your family, connect with friends. If you don't have any friends or family, figure out what you can do to really protect your mental health during the next couple of months. I say it flippantly because, it is the holiday time, but I know we have a loneliness epidemic right now as well. A lot of people are feeling isolated. COVID really impacted, especially our younger generation. A lot of people are on their phones, they're on computers. Try to step out of that kind of comfortable space you've gotten into in the last couple of months to years and try to connect with people outside of a computer screen, because that one-on-one connection can be really helpful when it comes to your mental health. And again, if you're immunocompromised, if you're sick, if you're worried about getting sick, there is no shame in wearing a mask. There really is no shame in wearing a mask, because I would much rather you go out and socialize and spend time with people and get that mental health benefit and wear the mask to prevent yourself from getting sick if you're worried about that, than staying home and missing out on what could be a really fun holiday season for you.
I still wear masks. No shame. No shame in my game.
Yeah.
If it protects
Same.
me and it protects you, I have no problem with it.
Exactly. I wear it in my clinic with every patient I see. I wear it when I travel. My kids still wear it when we travel, and they know. They say, you know what? We're going on vacation. I don't want to be sick when I get there. And it's just become a part of our routine. And I tell them, I say, if somebody says something to you, just tell them, say, I'm trying not to get sick because I want to have fun on my vacation. And that is totally okay.
Absolutely. Well, we've come to the end of our time together. It has been such an informative time. I have enjoyed it so much. How can our listeners connect with you to hear more about women in medicine and all of the things that you do?
So you can find me on most social platforms at Shikha Jain MD. You can find Women in Medicine at the website wimedicine.org, or you can find us on most social media channels at WI Medicine across TikTok, Instagram, all the platforms. You can reach out to me directly if you'd like, and I would love to connect with you if you ever have questions or if you want to learn more about women in medicine. We're doing some pretty awesome work to drive change in our healthcare systems nationally. So would love to hear from anyone.
Love that. We will make sure that all of her links are in the show notes. So head there to find out more information. Thank you so much for being here. It's been a pleasure. And make sure all of you listening come back for next week, because we're going to have another fantastic guest sharing more information on how you can survive this holiday season while keeping your sanity intact. Thank you for listening to the Holiday Survival Podcast. If this episode helped you feel a little bit more seen, supported, or sane during the holidays, it would mean so much if you'd leave a rating and review on Apple Podcasts and tap the 5-star rating on Spotify. It's a simple way to help more people find the show, and it truly makes a difference. For resources, links, and next steps from today's episode, just check out our show notes and be sure to click the follow button on whatever platform you're listening to this on so that you never miss an episode from this season. Remember, you don't have to navigate the holidays alone. Take care of yourself, and I'll see you in the next episode.